You have been told something that may be costing you your kidneys. Maybe it was your doctor, maybe it was a family member, maybe it was just the quiet voice in the back of your own mind telling you to stop worrying. And what you were told sounds reasonable, even reassuring. You're getting older. The swelling is normal, the fatigue is normal. That's just how it is now. I need to look you in the eye right now and tell you that is one of the most dangerous half-truths in medicine today. My name is Dr. Grace Wells. I'm a kidney and diabetes health educator for older adults, and I have spent over 15 years sitting with seniors who are losing kidney function silently, slowly, and completely unnecessarily because the signs were there, visible, undeniable signs, and nobody taught them what to look for. Today I'm giving you 7 of those signs, things you can see right now in your own bathroom without a single blood test. And if you have diabetes, please pay especially close attention. Your risk is not just higher, it is in a completely different category. And I'll explain exactly why in just a moment. But before I hand you that list, I need you to understand something first. Why these signs appear on the outside of your body. Because once you understand that, these 7 signs will never leave you. You will carry them for the rest of your life. Stay with me. What comes next may be the most important thing you hear this week. Your kidneys filter every drop of blood in your body, approximately 200 liters every single day, removing waste, regulating fluid, managing blood pressure, and producing the hormones that keep your heart rhythm steady and your bones strong. And they do all of this without a single signal. No pain, no warning, nothing. Here is the part that should stop you. Your kidneys can lose 40% of their function and your standard blood test will still look normal. The remaining healthy tissue quietly compensates, works harder, covers the damage, and your doctor looks at your labs, sees acceptable numbers, and tells you everything looks fine. Technically, in that moment, they are right, and they are also completely wrong, because compensation has a limit. And when that limit is reached, when the remaining tissue finally cannot hold, the decline happens fast, not over years, over months. Now, if you are over 60, there is a second problem sitting on top of this. After age 40, every person loses roughly 1% of kidney function per year. Natural, expected. But it means that by the time you are 70, you already have far less reserve than someone half your age. A common over-the-counter painkiller taken daily. A week of mild dehydration during summer heat. These are manageable for a 45-year-old. For you, they can tip a slow decline into serious, irreversible damage rapidly. And if you have diabetes, please hear this clearly. High blood sugar, sustained over time, damages the tiny blood vessels inside your kidneys. The filters scar. The damage accumulates quietly for years before any symptom appears. Diabetic kidney disease is the leading cause of kidney failure in the United States, not a risk factor, the leading cause, and it progresses silently for so long that most people don't discover it until significant function is already gone. There is one more thing your doctor may not have told you. The standard blood test used to measure kidney function, the creatinine-based eGFR, is actually less reliable in older adults with lower muscle mass. Creatinine is a waste product produced by muscle. Less muscle means artificially lower creatinine in your blood, which makes your kidneys look healthier on paper than they actually are. A 2019 analysis in the Clinical Journal of the American Society of Nephrology found that standard creatinine-based calculations significantly overestimated kidney function in a meaningful portion of older adults studied. Your doctor may genuinely believe your kidneys are fine. The test they are relying on simply was not designed with your aging body in mind. Before we go further, have you ever had a specific kidney function test? Not general blood work. A kidney function test. And do you have diabetes or a family history of kidney disease? Drop your answer in the comments right now. Just write tested or never tested. If you have diabetes, add that too. What comes back in those comments tells me more about the gap in senior care than anything I could say out loud. Let me tell you about Eleanor. Eleanor was 72 years old, retired librarian from North Carolina, type 2 diabetic for 11 years, well managed by every measure her doctor used. She walked, she watched her diet, she never missed her medications. Every morning, her ankles were slightly fuller than the week before. She mentioned it at her annual physical. Her doctor pressed his thumb into the skin, said, "Eleanor, that's very mild, very common at your age," and prescribed a water pill. She felt a little better. She trusted him. She moved on. Then came the mornings when her eyes looked puffy. Not dramatically, just different. Softer around the edges. She figured it was sleep. Maybe allergies. It faded by mid-morning, so she let it go. Then the fatigue arrived. And this is where I need you to really stay with me, because I hear this from patients over and over, and it never gets easier to listen to. It wasn't ordinary tiredness. Eleanor described it as carrying extra weight she couldn't put down. Getting up from a chair felt like a negotiation with her own body. She stopped her evening walks. She started napping for the first time in her life. Her daughter called one afternoon and said, "Mom, you sound different." Eleanor said she was fine, just tired, just getting older. Then one morning, Eleanor looked into the toilet after urinating and the water was foamy. Not a quick bubble that vanished. A persistent, soap-like foam sitting on the surface. She mentioned it at her next appointment. A urine test was ordered. Slightly elevated protein. "We'll recheck in 6 months," her doctor said. Eleanor came back in 3 months, not for a scheduled visit, because she couldn't put her shoes on. Her ankles had swollen so severely that she came to the appointment in open sandals in December. Her kidney function had fallen below 28% of normal. Stage 4 chronic kidney disease. With her diabetes, the prognosis was serious. She asked me, "Dr. Wells, were there signs I should have caught?" I told her the truth. There were at least 5 visible signs present for over a year before her diagnosis. None of them required a single blood test to notice. She was quiet for a long time after that. Now let me tell you about Raymond. Raymond was 67, retired electrician, came in because his wife gave him an ultimatum. First thing he said to me was, "I feel perfectly fine. She worries too much." I asked him one question. "Raymond, when you urinate, have you noticed any foaming or bubbling in the water?" He paused. Then he said, "Yeah, actually. For maybe 8 months, I figured it was something with the pipes." It was not the pipes. That foam is protein escaping through damaged kidney filters. Protein should never be in your urine. Raymond's urine albumin to creatinine ratio came back nearly 5 times the upper limit of normal. Stage 3 kidney disease. He had been watching the evidence every single morning for 8 months and explaining it away. We caught it in time. Dietary changes, medication review, removing the daily ibuprofen he had been taking for a bad knee for 2 years. His kidney function stabilized. Raymond is still my patient today. And he told me something I think about often. He said, "If I had known what to look for, I would have been scared enough to come in sooner. I wasn't scared because I didn't know I should be." That is exactly why this video exists. If something in Eleanor's story or Raymond's story felt familiar, if you found yourself nodding quietly, please don't dismiss that feeling. Drop a comment below. Just write Eleanor or Raymond, whichever one hit closer to home. I read every single one. All right, here they are. 7 things you can observe right now. No lab, no prescription, no appointment needed. Sign 1, foamy or bubbly urine that stays. Not a quick burst of foam from water hitting the bowl. Not bubbles that disappear in seconds. A persistent, soap-like foam that sits on the surface and lingers. That foam is protein. Protein should never appear in your urine. When it does, it means your kidney filters are damaged and leaking. This is one of the earliest, most visible signs of kidney disease, and one of the most dismissed. People blame water pressure diet, anything but the actual source. If you see it, do not explain it away. That is the one thing I am asking you not to do. Sign 2, puffiness around your eyes in the morning, specifically when you first wake up. Kidney-related swelling appears early and fades through the day because when you lie flat overnight, fluid shifts to the most delicate tissue. The thin skin around your eyes shows it first. This is not tiredness. It is not age. It is protein leaking from your bloodstream, causing fluid to pool in surrounding tissue. If it appears in the morning and fades by noon, write that down. That specific pattern matters. Sign 3. Swollen ankles, feet, or legs. Here is a test you can do right now. Press your thumb firmly into the swollen area for 5 full seconds. Then release. If you see a dent that stays, if the skin holds the impression of your thumb, that is called pitting edema. That is a clinical sign, not a sign of aging, a clinical sign. A water pill alone is not the answer. Sign 4, changes in urine color, pale yellow to amber, normal, depending on hydration. Dark tea-colored brown or reddish urine, not normal. If you ever see pink or red-tinged urine, that is blood. Do not wait for it to pass. That requires same-day evaluation, not tomorrow, today. Sign 5, skin changes. Severe, unexplained itching with no skin condition to explain it. Extreme dryness that lotions cannot fix. A subtle yellowish or grayish tinge to your complexion that people around you have started to notice. These are uremic toxins, waste products your kidneys can no longer filter, accumulating in your bloodstream and depositing in your skin. No cream, no antihistamine, no dermatologist appointment will fix this. The problem is not on your skin, it is coming from inside. If someone close to you has mentioned a change in your skin color, please do not attribute it to aging without ruling this out first. Sign 6, flank pain, not lower back muscle pain, not spine pain. A dull, persistent ache or pressure on one or both sides of your body, just below the rib cage, roughly where your thumbs land when you rest your hands on your hips. This is kidney inflammation. It is frequently mistaken for a musculoskeletal problem and treated as such for months, sometimes years, before anyone looks further. If you have pain in this area that has not responded to standard treatment, ask your doctor specifically for imaging that evaluates your kidneys by name. Sign 7, deep fatigue paired with brain fog, not just tiredness. The specific combination of physical exhaustion and mental cloudiness together at the same time. Difficulty finding words, thoughts that feel slow and heavy. Concentration that slips away mid-sentence. Failing kidneys produce less erythropoietin, which means fewer red blood cells, which means less oxygen reaching your brain and your muscles. This is not who you are becoming with age. This is a symptom, and it has a source. How many of those 7 did you recognize? Write the number in the comments right now, just the number, nothing else needed. I want to know what you're carrying, because that number tells me exactly how long this may have been building. Here is what separated Eleanor's outcome from Raymond's. 3 steps, specific, actionable. Start today. Step 1. Begin documenting right now. Take a photograph of any swelling. Note the time of day it's worst. Note whether it improves overnight. 2 weeks of dated photographs is clinical evidence that is very difficult for a doctor to dismiss. Walk into your appointment with that documentation on your phone, and the entire conversation changes. If you have diabetes, track your blood sugar readings alongside these observations. The pattern your doctor sees when both are present may connect things that seemed completely unrelated. Step 2. Ask for specific tests, by name. The standard creatinine eGFR alone is not sufficient for you. Write these down before your next appointment and say them out loud. First, a urine albumin to creatinine ratio. This directly measures protein leaking through your kidney filters. It catches early damage that standard blood tests miss entirely. Second, a cystatin C-based eGFR. Unlike the creatinine test, this is not affected by muscle mass and gives a far more accurate picture of kidney function in older adults. These tests exist, they are available. You simply have to ask for them by name. Step 3. Review your medications before your next dose. If you are regularly taking ibuprofen, naproxen, or any NSAID painkiller for arthritis, joint pain, hip pain, headaches, anything, this needs to be discussed with your doctor this week. NSAIDs restrict blood flow to the kidneys. In older adults, and especially in those with diabetes, they can accelerate kidney damage at a rate that is genuinely alarming. A 2020 study in the American Journal of Kidney Diseases found that regular NSAID use in adults over 65 was associated with a 58% increased risk of acute kidney injury from medications sold without a prescription, with no specific warning on the label for older adults. If you are also on long-term proton pump inhibitors for acid reflux, ask specifically about kidney safety at your next visit. Your medication list and your kidney function need to be evaluated together by the same doctor at the same appointment. I want to come back to Eleanor one more time. After her diagnosis, she did everything she could with the function she had remaining. She stabilized. She didn't recover to where she could have been. That opportunity had passed. But she got more time and she used it. She told me once, "Dr. Wells, if someone had shown me what to look for 3 years earlier, I would have gone in. I would have pushed. I would have caught this." That conversation is why I make these videos. Your kidneys have been working for you every single moment of your life. Silently, continuously, without asking a single thing in return. The very least we can do is learn to listen when they finally start speaking. Go through those 7 signs today. Not tomorrow. Today. If even one of them applies to you, pick up the phone this week and ask for a urine albumin to creatinine ratio and a cystatin C-based eGFR. Say those exact words to your doctor, and if someone in your life, a spouse, a sibling, a friend over 60, might need to hear this, please share this video with them. You may not know what they have been quietly dismissing, but now you do. Leave a comment below and tell me, are you going to call your doctor this week, or are you going to share this with someone first? I want to see both, and if you want to keep learning what your body is trying to tell you, especially when diabetes and kidney health are both in the picture, make sure you are subscribed, because this is exactly what we do here, every single week. No vague advice, no consult your doctor and eat healthy. The real information, the way I give it to my own patients. You stayed until the end. That tells me everything about the kind of person you are. Take care of your kidneys. They have been taking care of you your entire life.